This video was designed by the Michigan Department of Health and Human Services Provider Outreach and Education Unit as a resource for Medicaid providers to assist with submitting an institutional claim via direct data entry within CHAMPS. Direct data entry, or DDE, is an online process in which data is entered into a system and written into its online files. DDE through CHAMPS is one method for submitting claims to Medicaid. After logging into CHAMPS, by default, providers will be on the My Inbox landing page. To submit an institutional claim, click on the Claims tab and then select Submit Institutional. The institutional claim screen will display. Please note, if a beneficiary has insurance other than Medicaid, it will be pertinent to have this information prior to entering a claim. Also, asterisks denote required fields. As multiple provider types use the institutional claim form, not all items that are needed for the claim to be properly adjudicated may be marked as required. Providers should refer to the Michigan Medicaid Provider Manual for specific policy requirements. At the top of the screen are several useful buttons. The first is the Close button. Clicking this button will return users to the CHAMPS My Inbox landing page without saving any information entered. The next button is the Submit Claim button, which we will discuss later. After that is the Save as Template button. If users select this, any changes made to the claim may be saved as a template for quick access with future use. And the final button is the Reset button, which will delete any information entered and reset the claim form to the default options. Under the subheading Basic Claim Info are several shortcuts which can be used to quickly access the provider, beneficiary, claim, and service information on the claim. Clicking these shortcuts will take the user directly to the related section of the claim. Under the Provider Information section, the billing provider information is pre-populated. Users should confirm the correct National Provider Identifier, or NPI, has been populated in the Provider ID field. If the incorrect NPI is displayed, the provider will need to go back to the My Inbox tab and select Change Profile to select the correct NPI. The next step is to enter the attending provider's NPI. To do this, enter the appropriate NPI, select NPI from the Type drop-down, and scroll down to the next section. Under the Beneficiary Information subsection, enter the beneficiary's 10-digit Medicaid ID number in the Beneficiary ID field, followed by their last name and first name. Middle initial and suffix are optional if applicable. Next, enter the beneficiary's date of birth with a 2-digit month, 2-digit date, and 4-digit year. Then, select the beneficiary's gender from the drop-down. The information reported in these fields must match the beneficiary information on file in CHAMPS. If there is a mismatch, the information will be stripped off the claim and may cause the claim to deny. The next section will consist of entering claim information. The first field is a required field where the patient control number is needed. This is the provider's account number for the beneficiary at the facility. Providers can also enter the beneficiary's medical record number, but it is not required. The next required field is the type of bill. This is a 4-digit alphanumeric code that gives specific pieces of information after a leading zero. The first digit will always be 0 and is ignored. The second digit identifies the facility type, such as hospital or skilled nursing. The third digit classifies the type of care, such as inpatient Part A or outpatient or rural health clinic, and depends on the type of facility submitting the claim. The fourth and last digit is considered the frequency code and will signify an admission or hospice termination or potentially indicate a claim void or adjustment. The next field is the statement date, which is where providers should enter in the from and to dates of the claim or when the services were done. The next field is the admission date or hour. These fields are not marked as required. However, these fields are required for certain inpatient, hospice, and nursing facility provider types. This is where providers will enter the date that the beneficiary was admitted for care. The hour field is not a requirement across the board. In the next field, the admission type is only for inpatient claims and requires a 1, 2, 3, 4, 5, or 9, depending on the type of admission, such as newborn, urgent, or elective. Admission source is the next required field, no matter the provider type. The numbers or letters range from 1 through 9 or B through F, and in cases where a baby was born, use numbers 1 through 6 to signify the type of birth. The next field is the discharge hour, which is not required. After that is the patient status, which is a field that is required and is used to describe the patient's condition prior to discharge. The claim now gets into the nature of the illness or injury for why the beneficiary is at the facility. This is where the principal diagnosis code comes into play. It's important to enter in the code that was deemed chiefly responsible for the admission, even though another diagnosis may be more severe than the principal diagnosis. Entering any other diagnosis may result in the incorrect assignment of a diagnosis-related group, or DRG, and cause the hospital or facility to be incorrectly paid under the Prospective Payment System, or PPS. Present on Admission Indicator, or POA, is the next field and is not required. However, this field is available to signify whether the condition was present at the time of the admission. After that field is the Auto Accident State or Province dropdown, which is used to determine the state if the condition was the result of an auto accident. This is not a required field. Next, there is a required field where a provider must select the diagnosis code category. A provider may still need to select ICD-9 from the dropdown if they are entering in an older claim. However, most providers will select ICD-10 from the diagnosis code category dropdown. The next section, for any field that contains a plus sign, if the field is open, it will then be required to complete the field. If it was accidentally opened, simply click on the minus sign after it is open to close the field, which then would eliminate the need to complete any data. The first field with the plus sign is the condition information field. This is where a provider would enter in the code that describes any condition or event that applies to the billing period. If necessary, multiple condition codes can be added by clicking the Add Another hyperlink. Please note that payment may be affected depending on the condition codes added. Examples of codes that could be added here are 45 for ambiguous gender, or 81 for C-section or inductions medically necessary more than 39 weeks. The next section is occurrence information. And again, if the plus sign is selected, a code and date must be entered, where the code would identify a significant event that is related to a time period or span of dates that may have happened to affect payer processing. For example, adding an occurrence code of A3 would signify the beneficiary's primary benefits were exhausted, and then a provider would need to add a date of when they were exhausted. Another example would be for a hospice claim, where code 27 was reported because a certification or recertification was obtained during the billing period. Then the certification date or recertification date would be added in the date field. A few more examples regarding nursing facility claims, where code A3 was added for Medicare being exhausted, and then the date for when this occurred would be required. Or a final example where code 24 may be used to describe that primary insurance had denied the service, and the date for when the primary insurance had denied the service would be required. Moving on to occurrence span information. This section identifies a significant event that may affect payer processing, such as reporting a code of 71 to indicate there was a previous inpatient hospital stay, and then filling in the date span would also be required to indicate the from and through dates for that time period. Regarding a nursing facility claim where a code 70 was billed, the from and through dates of the 3-day qualified medical stay would be required. Another example would be billing for hospice. If an M3 code was billed, the from and through dates for when the beneficiary was inpatient respite care would be required. The next section is the value information section, where a provider would input in the field a specific code and related dollar amount to identify the monetary data for processing claims. For example, like a patient pay amount, or detailed information about the code, such as the number of covered days being reported, or codes indicating a monetary condition that was used by the intermediary to process an institutional claim. Some examples of these would be to report code D3 for a patient pay amount, and then list the amount in the value amount field. Additional codes that could be entered in the value code field might be 25, 26, 27, 28, 29, 33, or 34, which are all recognized for offsetting the patient pay amounts. In those instances, in the value amount field, a provider would put the amount that needs to be offset. Some additional codes for nursing facilities might be value code 80 to indicate the number of covered days the primary payer has approved, and then the number of days would be placed in the value amount, or code 81, which could also be listed to indicate the number of non-covered days, and then provide the number of days in the value amount field. Or a hospice provider may enter in the value code of 61, and then would add the core-based statistical area code in the value amount field. The next section allows users to enter a delay reason if required, because claim submission took longer than expected. A provider would need to select from the drop-down the reason for the delay in claim submission, such as authorization delays or third-party processing delay. As a reminder, be sure to close the field if the section is not required for your claim submission by clicking on the minus sign. If the beneficiary has other insurance, users should click on the plus sign and enter the pertinent other insurance information. If the beneficiary does not have other insurance, there is no need to click on the plus sign. For beneficiaries with other insurance, providers will need to complete the required fields of payer responsibility code, payer ID number, the insured's group or policy number, which is the number that identifies the other payer, the claim filing indicator, and the total COB payer paid amount. Providers can also complete the additional unrequired fields such as remittance date, subscriber member ID, subscriber name fields, and the beneficiary's relationship to ensure accuracy. This information should resemble or be the same as the information reported on the remittance advice from the beneficiary's primary insurance carrier. For outpatient claim types, providers will need to add other insurance at the header and at the service line level. For inpatient claim types, providers will only need to add other insurance at the header level. If the beneficiary has more than one other insurance, providers will need to click on the Add Another Payer hyperlink, and additional other insurance subsections will open. In the next section, prior authorization, or PRO, or referral number, may be required, given that there are occasions when a beneficiary requires services beyond those ordinarily covered by Medicaid, or needs a service that requires prior authorization, or PA. For Medicaid to reimburse the provider in these situations, MDHHS requires that the provider obtain authorization for these services before the service is rendered. If a prior authorization has been received for the service being provided, users will need to enter the prior authorization number, which was given when the authorization was approved. Providers must also indicate if it was obtained through MDHHS or through MPRO, and if the admission was a result of a referral, they should enter the referral number as well. For the diagnosis information section, users should not use decimals or spaces when entering the diagnosis codes. This section includes additional fields like admitting diagnosis code, which is a diagnosis code that describes the beneficiary's condition at the time of admission. A PPS or DRG, or rather the Prospective Payment System and/or Diagnosis-Related Group field, is for reporting the applicable code based on the diagnosis, surgical code, etc. There are then 3 additional fields to document the reason for the visit in the Reason for Visit fields. Next is the E-code field that would be used to describe an external cause of injury. A good example of utilizing the E-code field would be if the beneficiary came in with a broken arm from a motor vehicle crash to spell out exactly what happened. Next is the POA or Present on Admission field. This is an indicator that applies to the diagnosis codes and is required for inpatient claims. It is not required for E-codes or for admission diagnosis. The provider must select yes or no regarding the diagnosis and whether it was present upon admission. To add additional diagnosis information, click the plus sign. Providers should refer to the CMS Medicare website for the most up-to-date POA reporting instructions. The next section is procedure information used for surgical codes, which is used to describe the medical or remedial services performed or supplies, drugs, or equipment provided. Enter the applicable code for the reason for the visit in the Principal Procedure Code field and enter the date for when the procedure or service was performed. If additional procedure codes need to be entered, click on the plus sign for other procedure information. These next few fields are all in relation to who performed the procedure or service during the claim period. They are required when a surgical procedure code is listed on this claim. If an operating physician is needed on the claim, click the plus sign. The provider ID will be the NPI of the physician who performed the operation. In the type drop-down, you will need to select NPI. If another operating physician was needed, select the plus sign to add in their NPI information as well. If a surgery was not performed and rather a rendering physician NPI or healthcare professional who delivers or completes a particular medical service or non-surgical procedure needs to be listed on the claim, Click the plus sign to enter the rendering physician information. The provider ID will be the NPI of the physician who performed the service. Or, if there was a referring physician who referred the beneficiary to the physician who performed the service, add the referring physician NPI to the claim by clicking on the plus sign for referring physician information. The last section available to click on the plus sign to open up a field is the Claim Note section. If a claim note needs to be entered, click on the plus sign to expand the note section, which will allow up to 80 characters, and enter the claim note. For example, if documents were being submitted using a document management portal, enter that in the claim note field. The question, does this claim have backup documentation, can be answered with a yes or a no and does not open any additional fields. Moving on to service line items. This is where details about the services provided will be added. Revenue code is a required field which is used to identify specific accommodations and/or ancillary charges. This field is used to explain each charge, and providers must list the 4-digit revenue codes in ascending numeric sequence and not repeat on the same bill to the extent possible. An example of a revenue code would be 0120 for room and board. The HCPC code field is used to report the procedure for ancillary services. For the modifier field, users should enter a modifier if the procedure code requires one. Providers are able to add up to 2 characters each. The HCPC description field is not required, but gives a description of the HCPC code. The service date field is a required field for outpatient claims. Hospitals should report line item dates of service on all bills containing revenue codes, procedure codes, or drug codes. This includes claims where the from and through dates are equal. Enter the service start date for this line item. Under the last date of service field, enter the last date of service for this line item. For the service units field, users should enter units of service for this line item. Per CMS, generally the entries in this column quantify services by revenue code category. For example, the number of days in a particular type of accommodation, pints of blood. However, when HCPC codes are required for services, the units are equal to the number of times the procedure or service being reported was performed. In the total line charges field, users should enter the dollar amount for the selected line item. Per CMS, this is the field in which the provider sums the total charges for the billing period for each revenue code, or, if the services require, in addition to the revenue center code, a HCPC procedure code, where the provider sums the total charges for the billing period for each HCPC code. The non-covered line charges field is not a required field, but in this field users can enter the total line amount charges for non-covered items. The total non-covered charges pertaining to the related revenue code can be entered here. Under the Operating Physician ID field, if the Operating Physician ID is different from the header information, the user should enter the NPI and select the type of NPI. Similarly, for the other Operating Physician ID, if different from the header, users should enter the NPI and select NPI. Additionally, if the Rendering Physician ID is different from the header, users should enter the NPI and select the NPI as the type. If the Referring Physician ID is different from the header, the users should also enter the NPI of the Referring Physician ID and select NPI as the type. If a National Drug Code or NDC is required, users should enter the National Drug Code in the National Drug Code field and also enter the quantity and then select the appropriate unit and qualifier options from the drop-down menus. The prescription or link number can also be entered. If a prescription date is required, users should enter the appropriate date in the associated fields. Once all the information is entered for the service line, click Add Service Line Item. The service line has now been added to the claim. The user will be returned to the top of the claim and will note that the service line item information fields and basic line item information fields will become blank to enter additional service line information. After the service line item has been added, users will be able to see it in the previously entered line item information section, which will show the total submitted charges for all lines, each individual line number, revenue code, HCPC code, modifiers, dates of service, units, charges, and any non-covered charges. If the beneficiary has insurance other than Medicaid and the primary payer broke down the service line by line, users should select Insurance Info at the line level. Please note, if the beneficiary has other insurance, it must also have been added at the header level, or users will receive an error when attempting to add it at the line level. After clicking the Insurance Info hyperlink, an insurance information window will open. Users should select Yes to the question, does the beneficiary have insurance other than Medicaid? The Other Insurance Information subsection will open. The Primary Payer Responsibility drop-down options will be available based on responsibility information that was entered at the header level. Users should select the appropriate responsibility and enter the dollar amount paid, which corresponds with the reason code. Optional fields of the remittance date and reason codes, amounts, and adjustment quantities can be entered. If additional reason code fields are needed, users can click the Add Another Reason Code hyperlink. If the beneficiary has more than one other insurance, the Add Another Payer hyperlink can be selected to add the tertiary insurance. When information on this page is complete, users should click the Basic Claim Form tab to return to the claim. As a reminder, other insurance information should be entered separately for each line that it is necessary to have on the claim. Once all line items have been added to the claim, after reviewing the claim to ensure all information is accurate, users can click Submit Claim at the top of the screen to submit the claim. A pop-up window will appear to show claim details, and a transaction control number, or TCN, will be listed that was assigned to the claim. From this window, providers have the options to click Upload Documents, which will open the Document Management portal, click Print to print the submitted claim information, or click Close to complete the claim submission process. If providers do not need to enter another claim, clicking Close again will return users to the My Inbox landing page. Thank you for taking the time to view this video regarding submitting an institutional direct data entry claim within CHAMPS. For additional resources and helpful information, please visit our webpage at www.michigan.gov/Medicaid providers. If you have additional questions or would like to provide feedback on this training video, we encourage you to contact Provider Outreach at provideroutreach@michigan.gov. Providers needing help using CHAMPS or with claim assistance can contact provider support by email at providersupport@michigan.gov or by phone at 1-800-292-2550. Thank you for participating in the Michigan Medicaid program.